Okay, so next I wanted to discuss nursing values and which ones you feel are most important to your position as a case manager and the care you give to your patients.
So I think first and foremost, you have to have integrity. I think you need a level of integrity with patients because that's what's going to drive your care. In addition to integrity, I think that you should have compassion. I think that's a great big thing. And I think also that when it comes to nursing, we can't have biases. So we have to have that field of justice that everybody is created and everybody deserves care. I don't care about what your sexual whatever is. I don't care about what whatever you feel that's best for you and whatever you recognize yourself as and identify yourself as. Then as a nurse, that's what we have to do.
Right.
It's all about care because I don't want to do something that will impede the patient's care because I've said something and done something in a certain way. The patient clams up and cannot express themselves. So I don't want to ever be that type of nurse.
Great, that's a great point of view. What are some of the levels of care that are implemented in case management? So do you more so deal with the individual or the family or the community? Like how does case management interact with the level of care as a whole?
So with case management as well as with my current role, you deal with the patient, but you're bringing in resources, whatever it takes to get that patient to the next level in care with the optimal outcome. So you deal kind of with a little bit of everything because sometimes someone may need a resource for psychosocial help. Someone may need a resource for their kids. So you can't take care of the patient if you don't address the whole issue, and you have to look at the whole issue and address the patient in totality, and that includes just bringing everything into play with the patient, whatever it takes. I can't deal with the patient, and I know that I can't take care of a patient and that patient's worried about whether the kids can eat or not, or this, that, and so whatever resources that I have available, whatever I have, I try to give that to the patients and kind of direct them with care.
Okay. So types of technology or